Hello everyone, Dr. Taylor Levine from Unruh Spine Center, where today I'm going to be going over some conditions that you may not know myself as a chiropractor can help you with. I'm going to not only talk about how we can help you deal with some of these issues at home with some stretches and exercises, but I'm going to give you a glimpse of what some treatments may look like if you come into office dealing with these conditions. A condition that I often have patients come into my office for is shoulder pain. And shoulder pain can present itself in a few different ways. Some people deal with shoulder pain in the front, some people deal with shoulder pain on the side, some people deal with shoulder pain in the back. When people are dealing with these shoulder issues, it could be from a multitude of things. It could be that they're dealing with their labrum, which is something that holds this ball into the socket here. Some people can be dealing with point tenderness pain right over particular areas. These conditions, there are certain tests that we'll run or potentially images to find out what you may be dealing with, and that way we can lay out a course of treatment that suits you best. Some common conditions that you may Google and find that you may be dealing with and what we'll be able to help you diagnose is bicipital tendonitis, rotator cuff tendonitis or strains, bursitis, or dealing with some partial labral issues. Some of these conditions present in multitudes of ways, and that's why it's important that you come in and get evaluated to see what sort of care is going to be specific for your needs. So depending on your shoulder condition, it may warrant to get some treatment rendered on it to help facilitate the healing. One great treatment, and again, depending on what your condition is, would be shockwave therapy to help break up the adhesions and scar tissue to help facilitate the healing that needs to happen in that shoulder. It's great for people that are dealing with tendonitis, bursitis, frozen shoulder, and or general shoulder pain. And so right now I'm going to show you what that shockwave therapy looks like. And for right now, my patient right now is dealing with a little bit of bicipital tendonitis right in this front part of the shoulder here. So we're going to get some gel right over the area. And I'm going to get this treatment started. We're going to start off with a lower intensity and we're going to work our way up. If it feels a little uncomfortable, that's fine. If it gets a little painful, let me know and we'll tone it down. Okay? Doing okay with that? Okay. Turn it up a little bit. Doing okay with that? Yeah. That's good? Okay. So just like I've explained in a few of my other videos that I've made on shockwave therapy, when we get the shockwave treatment rendered, we are bringing a bunch of really good healing blood supply to the area. So I always recommend that we're not going to do any ice over that treatment area when we get that treatment done on that day. Now you can definitely ice any, especially the shoulder area on the next day to help just decrease some of the agitation that you may be dealing with. And typically we'll be doing this treatment either twice a week or 3 times a week. Typical treatments range about anywhere from 5 to 6 treatments for this shoulder issue that we're dealing with. Again, I'm Dr. Taylor Levine from Unruh Spine Center, and if you're dealing with this condition, please call my office and make an appointment. We'll get you evaluated and figure out what your best course of care is. We'll talk again soon.